Hey everyone, on today's emDOCs.net videocast, we're covering management of hemothorax, specifically size of tube thoracostomy and whether or not we should be irrigating following placement of the chest tube. Our first paper is small versus large bore thoracostomy for traumatic hemothorax, a systematic review and meta-analysis published in the Journal of Trauma and Acute Care Surgery, October 2024. The primary question of this meta-analysis was in adult patients with hemothorax, is small bore tube thoracostomy as effective as large bore for drainage? This was a registered systematic review and meta-analysis evaluating small bore versus large bore tube thoracostomy. Small bore was defined as anything 14 French and smaller. Large bore was defined as anything 20 French and greater. Authors included RCTs and cohort studies evaluating adult patients with chest injury and a hemothorax or hemopneumothorax who received tube thoracostomy. The primary outcome was failure rate. The secondary outcomes included ICU length of stay, hospital length of stay, drainage output, tube thoracostomy days, complications, and then finally pain. Let's get to the results. Authors included 11 studies published between 2002 to 2020. There were 3 RCTs, 3 prospective cohorts, and 5 retrospective cohort studies. For the primary outcome, there was no difference in tube failure rate. That was not statistically significant when it came to 17.8% versus 21.5%. For secondary outcomes, there was no difference in overall complications, length of stay, or mortality. However, small bore tubes did have a higher initial drainage, just over 700 compared to just less than 400 for large bore tubes. There were more insertion-related complications with small bore tubes, like kinking, dislodgement, but there was less pain, less need for VATS, and less total tube thoracostomy days. This study asks an important question. The classic teaching is that we should be placing a 36 or 40 French-sized chest tube for drainage of hemothorax. But in 2021, the Eastern Association for the Surgery of Trauma published guidelines that support the use of small bore tubes, but those guidelines were based on very low quality evidence. This was a registered meta-analysis, and they followed the PRISMA checklist. However, there was significant heterogeneity. There were only 3 RCTs. There were many differences in patients in terms of injury patterns, ages, when they placed the chest tube, and the outcomes evaluated in the individually included studies. The bottom line from this meta-analysis is that small bore tubes may be as effective as large bore for drainage of hemothorax, but authors state that they need higher quality data. I do think that we have good enough data here that if you have a stable patient and they have a hemothorax or hemopneumothorax, they don't need emergent tube thoracostomy, they're not decompensating in front of you, then you can consider using small bore tubes. You are backed up by guidelines here. Just make sure your surgeon is okay with that. Our second paper for today is Thoracic Irrigation for Traumatic Hemothorax, a systematic review and meta-analysis published in the Journal of Trauma and Acute Care Surgery, 2025. Anywhere between 10 to 20% of patients with hemothorax can have retained blood. This can lead to all sorts of complications like fibrothorax and empyema, but several studies have looked at irrigating following chest tube placement for hemothorax. This was a registered systematic review and meta-analysis that sought to evaluate whether irrigation following chest tube placement for hemothorax would reduce the rates of tube failure and also complications. Authors included 6 studies, 4 prospective studies, and 2 retrospective studies with a total of over 1,300 patients. Authors ultimately found that irrigation may be associated with lower complication rates, lower rates of tube failure, less need for additional procedures like second chest tube, VATS, open thoracotomy, and lower cost. However, I don't quite think this is ready for routine use in the ED setting, but don't be surprised if you hear your surgeons talking about this. In summary, we talked about small bore versus large bore tube thoracostomy for hemothorax, and second, we looked at irrigation for hemothorax. Thanks for watching, and stay safe and healthy, everyone.